You're watching Lung Cancer Awareness United in Our Goal, an initiative by Lung Connect India Foundation. Now, advancements in research, development and cost-effective therapies hold promise for improved patient outcomes and enhanced quality of life. How can we use them to transform the fight against lung cancer? Joining me this morning is Dr. Kumar Prabhash, Professor and Medical Oncologist, Tata Memorial Cancer Hospital, Mumbai. Thank you so much, Dr. Prabhash, for joining us today on NDTV. To begin with, if you can tell us, how does research help in patient care?
So research is a very important part of development in any field. That is true for cancer treatment also, and that is true for lung cancer also. As we have seen in the past in human science, that we had cholera, plague, which were rampant. And that has been resolved primarily because of research which has happened. In the cancer also, we have seen there is a significant development in the outcome, and that is primarily because of research and its implementation. Same is true for lung cancer. In the recent past, there has been significant development which has finally shown that in lung cancer patients, the patients who gets diagnosed, they can live longer, they can live better.
What is the status of research in lung cancer in India?
Overall, the research is usually limited in India. And this is not only my view. This has been recent statement and comment by Mr. Narayan Murthy, who was the ex-Infosys chairman. And yes, that is true. Yes, there has been an improvement as far as the last few decades are concerned, but then also the research is limited in lung cancer in India. If you put some numbers to get a hang of it, the number of research article which goes from India, and if we compare to China, China has almost 10 times the research article in lung cancer as compared to what we get from India. That gives you a perspective that yes, we are having some research in India in lung cancer, but we have got a long way to go, especially if we want to have a global impact in lung cancer in the world and to improve the patient care in our own population.
Okay, can you share with us a few examples of research done by you and how it has helped patients in India?
In lung cancer, we did what we call molecular profiling, what it means the genetic profiling of lung cancer. And what we found that we have a relatively distinct genetic profiling in lung cancer in India, which helped in testing and also providing treatment for those cancers. And this was especially true in the squamous cell carcinoma of lung cancer, where our profiling was fairly different. And what we find now in the global guideline also, molecular profiling for squamous cell carcinoma of lung cancer becomes a part of routine care where we had done the initial research. We also did a research in providing the optimal and cost-effective treatment for our patient. In a patient with what we call EGFR mutation positive lung cancer, we developed a treatment combining gefitinib with chemotherapy, and which was developed few years back, and it was as good as the treatment which was developed at that time in the Western population. And that time the cost of the treatment, which was usually considered standard of care in global population, was few lakhs rupees, and the treatment we developed combining the gefitinib plus chemotherapy, the cost was around 7 to 10,000 rupees, which most of our population, most of our patients can take it. We also developed in head and neck cancer low dose immunotherapy, which decreased the cost of immunotherapy from few lakh rupees to few thousand rupees, and also allowing most of the cancer patients, especially in head and neck cancer, to able to afford that treatment.
Dr. Prabhash, we know that Lung Connect India Foundation is India's first patient support group dedicated to lung cancer. Can you tell us how critical is its role in the fight against lung cancer?
The patient advocacy is a very important component in improving the patient care by providing voice to the patients. We know that there are a whole lot of discussion which happens among doctors, among policymakers, but it is very important that patient voice reaches to the clinician and also to the policymakers. So in that context, patient advocacy becomes very important. This is very fairly well developed in the Western world. In our part of the world, there is a requirement to have the patient voice which reaches the policymakers. And Lung Connect is one of those initiatives which I really commend and admire those people who took this initiative. So this is very useful work, and they are trying hard to see that their voice reaches the policymakers and their voice reaches the clinician. So in that context, it is a very good initiative, and I wish good luck to them.
Thank you so much, Dr. Prabhash, for joining us today. Well, that's it today. But tomorrow we will be meeting the human face of cancer. So do join in. Thank you so much. Back to the studio for more news on NDTV.